There's really a lot of things that nurses can do, but most people kind of gravitate towards working in the hospital just because they think, oh, that's the only thing I can really do.
That's what I would have thought. Yo, what up everybody? It's your boy CB. We're back in the studio. Today we have a very special guest.
Caitlin.
Thanks for being here.
Yeah.
Caitlin's a registered nurse, and she's also in school right now to get her bachelor's in nursing.
Mm-hmm.
Right. So we're just gonna interview her and find out why she wants to be a registered nurse and the in and outs of this profession. So, without further ado,
Yeah.
Caitlin, can you tell us a little bit about what it means to be a registered nurse?
So a registered nurse, I mean, first thing you think of is someone who works in the hospital, but really there's a lot to it. You're really providing care on a holistic level. You're looking at the person physically, emotionally, spiritually. You're treating all sorts of things, and really you don't want to treat them for their illness, but you want to treat them as what they are, which is a person. So,
Yeah. So how does a registered nurse differ from like different types of nurses?
So there are three main different nurses. There is an LPN, which is a licensed practical nurse. There's a registered nurse, and there's an advanced registered nurse practitioner. Basically, it all comes down to the level of education that they receive and their scope of practice, so what exactly they can do. An LPN, they can do basic vitals, basic care, administering medications. That's mostly what they do. They mostly work in nursing homes where there are a lot of patients who have close to 30 medications that they need to be given at a certain time. So they mostly do a lot of medication passes. And then registered nurses, they can provide more care plans to patients. They can do more education to them. They're not only in hospitals, they're also in clinics, office settings, and they can also do preventative care because of the education piece. Advanced registered nurse practitioners, they get a graduate level education.
Is that one year?
It's usually about 2 to 3 years. There are different specialties that they can do, so it depends on that too.
It's a lot of school.
Yeah, so they either, depending on the state, they work parallel next to or under the supervision of a physician.
Okay, nice. So out of all the nursing professions, or out of all the professions in general, like, why did you choose to be a registered nurse? I've always known that I wanted to do something in healthcare, but I wanted to do something that would allow me to interact more with patients and have a closer relationship. I am looking to move up as well, so that's where I want to get the bachelor's. Okay. Yeah, okay. That was going to be like another follow-up question.
Yeah.
So I recently learned that you only need an associate's degree to become an RN, but you're actually in school to get your bachelor's. So can you tell us like why you're going that extra mile?
Yeah. So recently there's been a push for nurses to get their bachelor's in science and nursing, which is also BSN. This is just coming with all the advancements in technology and the economy. It's kind of more of a title thing, a formality, but really nurses who have an associate's versus their bachelor's, they have the same qualifications, they can do the same exact thing. But if you are looking to move on to graduate school or do something like nurse management or public health or education, that's where you'd want your BSN.
And nurse management is like the next step for grad school.
Yeah, it can be. You can do nurse management, you can also do nurse practitioner as well.
Okay, so in order to move up, you sort of need a bachelor's because a bachelor's is required to apply to graduate school.
It is, yeah.
Okay.
Yeah. They also like that you have more experience. It'd be easier because you have more experience treating patients, interacting with patients, rather than someone that's coming straight from school to get their graduate.
Okay.
Yeah.
Okay, so can you tell us a little bit about like your track? Like, are you working as a nurse right now? We know you're going to school.
Yeah.
Where do you see yourself in like 5 to 10 years?
Yeah. So I am working right now part-time. I'm working as a pediatric home health nurse.
Mm.
So that's part-time, but I'm also going to school, finishing up my bachelor's. I have a few more months left. I'm almost done, but sorry, I forgot your other question.
Oh. Like, so where do you see yourself in 5 to 10 years? Do you want to go to grad school or?
I'm thinking about going to grad school. I also do hope after I finish my BSN to move towards a hospital setting because I do want to stay in the pediatric population. That's kind of where my heart is. I really enjoy it, but I've always wanted to do bedside nursing. My goal is to work at Seattle Children's Hospital eventually,
yeah.
So I'm hoping to get there with my BSN.
Yeah, that's a good one.
Yeah.
So were you then doing your AA for registered nurse at the same time you were doing your BSN?
It's kind of complex. So the program that I am in, it's a 4.5-year program. So you get your associates first, and then you go back to the university to finish your bachelor's. It's easier because you don't have to reapply for your BSN. You already have that spot.
Okay.
Yeah.
Nice.
So that's what I'm in right now, and that's why I'm finishing my bachelor's right after my associates.
Cool.
Yeah.
Well, seems like you got everything figured out.
Kind of. I'm taking it step by step.
Okay. And so as an RN, like what kind of settings would you see? Like would you like be working like strictly in hospitals, or can you do like home health, or what's the scope of RNs?
So they can do a bunch of things. There's really a lot of things that nurses can do, but most people kind of gravitate towards working in the hospital just because they think, oh, that's the only thing I can really do.
That's what I would thought.
Yeah. But no, there's a lot you can do. We can do what I'm doing, which is home health nursing. There are different populations that you can work with. You can also do preventative health care, which is like working in a clinic or an office. You can also kind of do some education as well as a nurse. So there are a lot of different things. Also school nursing. So
okay.
Yeah.
Cool. Nice. Yeah. So it's a lot of mobility, I guess.
There's a lot of flexibility. You're not really stuck in one place.
Yeah.
If you enjoy something for a little bit, but you kind of are looking to do something else, there's always a lot that you can do as a nurse.
Yeah.
Yeah.
And I feel like nursing's a pretty like hot profession. Like a lot of people are going into nursing.
Yeah, it's great. It's definitely not something you want to do if you're just in it for the money.
Oh, okay. Good to know.
Yeah. It's hard, it's difficult physically, emotionally, mentally, but it's very rewarding.
Okay,
yeah.
Nice. So what's like, then what advice can you give students coming in? Would you tell them to like, oh, just get your AA or get your BSN? Like,
you know, it kind of depends on their goal and what they're looking to do with their life, but really you kind of have to adjust to what everyone's asking you to do. Like a lot of employers are asking you to get your BSN, so you might as well get a BSN. Yeah, it's only a couple more years, which isn't too bad. But I mean, if you're thinking about doing nursing, I definitely say to go for it. Don't let the coursework intimidate you. There's a lot of people out there who are like, oh, nursing's so hard, like I can't do it, but really it's doable. Like if you really apply yourself, you can do it. And also you should have a passion for it. It's not, like I said, it's not something you do just for money. It's not just a job. You're really caring for people. Like it can be hard, but it's really, really, really rewarding.
I feel like that's a common theme for jobs. You should not do it for the money.
Because I mean, if you think about it, you're doing it for your whole life. You don't want to spend your whole life doing something that you don't enjoy.
Do something fun.
Yeah.
Have fun with it. Yeah.
Exactly.
Okay. Let's just wrap it up, I guess, with a final question.
Sure.
If you can go back in time, would you do anything differently?
Yeah, this is the hard one.
Honestly, I don't think I would. I mean, a lot of people shy away from kind of getting your associates or going to a community college.
Mm-hmm.
They'd rather go to like a big university or a 4-year program. But really, I ended up in the same place as all of those other people too.
Yeah.
So I'd say no, I don't regret doing anything.
That means you made the right choice.
Yeah, which is good to know,
Yeah.
actually. I ended up working with the population that I wanted to work with, which is pediatrics. I like the position I'm working in now. I like my job, and I'm
Alright.
still in school,
Yeah.
but I'm almost there.
You're almost done.
Yeah.
And once you're done, you'll be done forever. So there we go. Oh, if you
Maybe.
maybe if you go back to grad school.
We'll see. I'm keeping myself open to
Yeah.
options, yeah.
Well, that's good.
Yeah.
All right. Well, Caitlin,
Yeah,
thanks for being on the show.
of course.
If you guys like the video, be sure to comment, like, subscribe, and all the other stuff.
Thanks for having me.